Do you want to take control of your brain health? Listen to Defy Dementia, an empowering new podcast at Baycrest dedicated to helping you reduce your dementia risk. Join us as leading scientific experts share practical tips on how you can keep your brain healthy and age well, and hear inspiring stories from people with lived experience, including the world's oldest bodybuilding champion.
Regardless of your age, this is a podcast for anyone with a brain. Defy Dementia is co hosted by Canadian author and broadcaster Jay Ingram and our very own Dr. Allison Sekuler. Search for Defy Dementia wherever you get your pods or visit us at our website, defydementia.org. That's defydementia.org.
Happy New Year, and welcome back to the Community of Innovation podcast brought to you by the Center for Aging and Brain Health Innovation, otherwise known as CABHI. I'm Allison Sekuler, President and Chief Scientist at CABHI and the Baycrest Academy for Research and Education.
And I'm Rosanne Aleong, Executive Director of Research, Innovation, and Translation at the Baycrest Academy and the Director of Research, Innovation, and Translation at CABHI. Happy New Year to all of our listeners, and in honor of Alzheimer's Awareness Month, we're kicking off the first episode of Season 5 with careful consideration of what cultural safety in dementia care is, what it is, why it matters, and how to do it.
We'll be talking with our guests about how caregivers can provide an inclusive and respectful environment that recognizes and addresses the unique cultural backgrounds and experiences of individuals living with dementia. And this approach really is intended to ensure that care practices are sensitive to diverse cultural norms and values and preferences, and that they can then foster a more personalized and effective care experience.
This approach also helps to reduce stigma and ensures that those care practices align with the values and preferences of those that are receiving care. All right, Allison, 2024 kicked off with a bang. Two amazing guests. What stood out for you?
I think what stood out for me, first of all, is how much we don't know about dementia in different cultures, in different groups. It's often thought, that, well, dementia care should be treated as a monolith, but it was quite clear that what may work for one group or for one person in that group could be so different than what might work for someone else. And you really need to have that personalized approach to be able to make sure that someone's living as much as they can with dignity and purpose and fulfillment. What stood out for you?
So I think trust was a huge theme that came out during our conversation, that culturally sensitive care really builds trust between, the person living with dementia, their family, and care providers. And that can have really significant downstream impacts, not only for the circle of care, but for the system. So, having that trust means that people are more engaged in their own care, can advocate for themselves, maybe are willing to access other services, and that can obviously have great impact for the system. So I think it only reinforced to me and hopefully to our audience why this is such an important topic to focus on and for something that we need to do.
Yeah, so let's let our audience get to it so they can do it, and let's get to the show. Our first guest is Chenny Xia, a serial entrepreneur and advocate for health equity. As the CEO of Gotcare, she's transforming how healthcare in the home is delivered regardless of your postal code, including service to over 100 remote communities. Having scaled rapidly across the country, Gotcare has been recently named one of Canada's fastest growing companies in 2023 by the Globe and Mail. Chenny also plays several advisory roles. She was previously a member of Ontario's Task Force on Women and the Economy, and she's currently advancing women and non-binary-led entrepreneurship through Corrales, which is formerly known as SheEO. Welcome, Chenny.
Thank you so much for having me. Pleasure to be here.
Our second guest is Ngozi Iroanyah, who is the Director of Health Equity and Access with the Alzheimer Society of Ontario, where she develops and leads province-wide equity-focused initiatives that builds capacity, awareness, and strengthens programming within the Alzheimer Society of Ontario and its 26 local societies to support members of diverse communities. She is also currently a PhD student in the Faculty of Health at York University, where her research focuses on the impact of dementia policies on the lived experiences of Black older adults living with dementia and their caregivers. But most importantly is her role as a primary caregiver to her father, who lives with end-stage dementia. He is her inspiration for the work that she does. Ngozi, welcome to the show.
Thank you, Allison, and thank you to Rosanne for having me here. I'm really excited to be here and very much looking forward to the conversation today. Thank you.
So to begin, I wonder if we can level set a little bit by giving our audience an idea about what access to dementia care looks like in Canada today. Ngozi, I wonder if you want to start off with that.
Yeah, I think before we do that, I'd like to sort of set the stage with what is happening in Canada with respect to diversity and dementia. So, as we understand it, we have about 600,000 people living with dementia as of 2021. But we don't know the lived experiences of those from an ethnocultural lens. We have an increased older aging population. So, we have about 7 million people who are over 65. And we have more diverse people than ever before in Canada. 1 out of every 4 people identifies as being foreign born. 1 out of every 4 people, almost 3, identifies as being from a racialized, ethnoculturally diverse background. So those intersections really set the stage for how we need to understand why we need to have dementia care services that really represent those populations. Right now, though, how we understand dementia care in Canada, it's not really taking into account these different needs and perspectives from these different populations. It's very much seen as a sort of Western biomedical framing, which can sometimes leave out these unique perspectives and needs. And we create these gaps as a result that people can really fall through when it comes to specialized care with how they understand dementia, how they approach dementia, how they deal with it within their families.
Ngozi, you've given a great, overview of where we look like in terms of the dementia space in Canada and the changing demographics. So, Chenny, from Gotcare's perspective, as you deliver care in the community with your clients and with your healthcare providers, where are you seeing the impetus for culturally safe care coming from? Is it coming from the older adults themselves, their families, other organizations like Alzheimer Society? What have you seen?
Yeah, for sure. I think that one of the things that it's important to acknowledge in this is also the HHR crisis, so the health human resource crisis that we have right now. So we have record-breaking wait lists for long-term care and home care. Hospital wait times are extremely high for many people, especially those living in more rural populations. Getting access to primary care is extremely challenging. So I think that it's important to have that as background, because there is this general feeling of getting what you can get, as opposed to feeling like that you are able to access personalized care. So I just add that as a little caveat. I think that there are a lot of challenges for people who are experiencing, especially those who are experiencing more moderate or severe dementia. As we know, just to give an example, one of the things that can happen is that people with more moderate or severe dementia can often regress to their primary language, just due to how dementia can impact our parts of the brain, especially when it comes to memory. And so as a result, if you feel like you are not able to confidently express your needs or how you are feeling without feeling seen by your family, your circle of care. So that could be, for example, a translation issue. It could be a cultural nuance issue. So as a result, what can happen that we've seen is that we have certain clients who are living with dementia who end up, sort of shutting down, so to speak. And by the time that we find them, we find that they often can kind of spark back into this feeling of being able to advocate for themselves when they are paired with someone who can deliver that culturally appropriate care. So, for example, I'm thinking of a client in my mind right now. He's in his mid 80s, Portuguese background, and it was so interesting because the thing that made the biggest difference for him was our Gotcare worker cueing Portuguese operas for him on our patient tablets that played every day. And just that simple intervention alone actually allowed him to feel like he was able to trust our care worker and then get back into the spirit of advocating for himself again.
And I'm wondering, I mean, you mentioned the Portuguese example. Like, I'm assuming you don't want to give the impression that the way that you care for one person of Portuguese origin is the same as it would be for everyone else. So I wonder if we can talk a little bit about the different needs of different communities. What does culturally safe care look like in those different communities for Indigenous people living with dementia versus someone from the Black community living with dementia? And how do we think about the fact that an Indigenous person is not representative of all Indigenous people, or a person from the Black community is not representative of all people from the Black community? So I don't know who wants to take this one to start. And Ngozi, sorry.
Yeah, certainly. I always want to preface this sort of conversation. So, first, with the notion that culture is not a monolith. So, when we talk about Indigenous populations, Black populations, South Asian populations, etc., it's not all one way of living, being, relating, understanding. Even there's many languages within, for example, the South Asian population. So, culture itself is not a monolith. There is diversity within that diversity. Now, in saying that, though, there are some generalizable features that we have seen in the research, which really help us understand some of the more, I guess, prevalent traits that you would see when it comes to the dementia journey within ethno-racial groups. So, for example, one is around caregiving. Within caregiving experiences, within ethnocultural communities writ large, caregiving tends to be done at home by family. So, and not just immediate family, it's also extended family. It's the aunts, the uncles, the cousins, the nieces, the second cousins, etc. So it's very much contained within the family. And that can kind of become problematic, let's say, when caregiver burnout begins to set in and conversations around, placing someone in a care home gets to be set in. And so people can sometimes feel very guilty and feel very ashamed for doing that because it's not part of their cultural experiences. So how does dementia care attend to those kinds of realities for certain families? Other things we've seen is around stigmatization around dementia. So in the Western world, dementia is very much pathologized in this medical framing of something, a disease pathology type of situation. In some cultures, writ large, again, dementia is not so much medical as it is cultural or religious based. It could be, oh, you've done something in a past life to someone, that's why you have this. Or you've been a certain type of way. This is your karma. And so, in that regard, the stigma around dementia is less about a medical perspective, but more about a cultural perspective. And not to be imperialist and say, oh, well, your culture is wrong. You're thinking of, you're different from us. It's just understanding that, dementia is thought about in various ways. And how can we find the best way to approach someone or approach a community who might have a different view of dementia, but can still provide them with care and provide them with early access to services and medications even that can help either delay the progression of dementia or enhance the quality of life that they might be living with. So it's really interesting to find out from the person with dementia, either in a care setting or a community setting, what it is that is culturally significant for them, so that the service provider can provide the best services possible.
Yeah, and Chenny, I wonder if you can, just following on that, give an example of how Gotcare is addressing some of those issues. So, I mean, I think that many people wouldn't recognize, the need for having the culture built into the care, and obviously that's something that you're very passionate about.
Yeah, I think one thing we do at Gotcare that's a little bit perhaps a different way to look at it is instead of seeing it as culturally appropriate care, we think of it as, who is this client? Like, what is their identity? And part of their identity may be their culture, as a strong part of it. And for others, it's not so much, right? So for each person, it really does vary. And I think what's most important, especially when it comes to people living with dementia, is this sense of comfort, right? At the end of the day, what's most important is this feeling of comfort. And so in the last example that I gave you, that gentleman, the reason why the opera spoke to him was because he used to be a part of the opera when he was working when he was young, and he was really proud about that, right? So really just getting to take a little bit of time during intake to get to know who the client is, how, who they are at their core, what do they really value, what do they really love, and just even getting to a couple things down, right? Just a couple things down, and having that being clearly communicated across the entire team so that everyone knows of those two things can go a really long way. Because often, like Ngozi was saying, if we can involve the family caregiver as a part of the process as well, they'll be able to pick up on all of the, the smaller details, especially if we can involve them. It's really just understanding that client's identity first. That's really core to us. So just to give you some numbers, what that pragmatically ends up meaning for us is that 87% of the time, we actually end up matching a client who's referred to us to a caregiver who speaks the same language, or at least has a shared cultural background to this person, so that, if, for example, meal support is a part of the care plan, then they are also getting culturally appropriate meals that bring them comfort, so food that brings them comfort as a part of that delivery. Or it can just even be in when that care is being delivered, let's say some personal care is being delivered, being able to have conversations and stories that are based on perhaps shared experiences, as well, as something that is really meaningful and brings comfort to people as well.
When you talk about safe professional care living with dementia, again, in my mind, it comes along, and in my experience, rather than what I've seen in research, it comes along from providing almost like a blanket kind of one size fits all model to dementia care. And so you have these professional standards and guidelines and practices of care that, again, are really rooted in a westernized framing of what dementia is, what mental health is, what seniors' health is, et cetera. And when you talk about culturally safe care, sometimes you exclude certain aspects. For example, so in some cultures, the word dementia is too stigmatized. You just don't say the word dementia. So you'll say things like brain health. You'll say things like aging well, aging better. You won't say the word dementia because it's just too stigmatized, and you're going to lose people when you start talking in those kinds of vernacular. In other aspects, it can be incorporating culturally safe pieces alongside the Western ways of delivering dementia care. So, for example, again, we talked about caregiving. So, if we want to institutionalize this sort of Western framing of caregiving, how can we include some culturally safe and appropriate pieces for a particular family or community that would make them feel safe for engaging with whatever medical complex or social care complex, where they could say, okay, you know what, I'm going to utilize these services because, it speaks to my experiences. And that's when you look at, long-term care centers that are culturally centered. Yihong is a famous one that services Chinese and East Asian populations. And so they're delivering dementia care within this kind of Western framing, but it's all very culturally safe and culturally specific. So there are ways in which we can look at culturally safe care that can take on some of these sort of more Western known kind of approaches to dementia care, or we can develop something a little bit different, which is really just going to be housed in the cultural perspective of those who need it.
Yeah, I love that personalized approach. It's terrific.
So I guess we've talked a lot about what culturally safe or personalized care looks like, but in the absence of that, what type of power imbalances can exist? So I think we've talked about what we should be doing, but what happens when we don't do that? Ngozi, do you want to kick us off? Like, what might that lead to?
Well, the first one I think of is fear. When you don't have culturally safe care with regards to dementia or really anything else, you're going to create a sense of fear in the people accessing those services. If they don't see people who look like them, if they don't hear people who sound like them, if they don't have approaches that resonate with their experiences or their own held values and sense of self and sense of understanding the world and the medical world, you're going to lose people. They're not going to want to come back. They're not really, maybe they're not going to want to really adhere to what you're saying and what you're offering to them. So lack of culturally safe care can really institute a feeling of fear for people, a feeling of loss and feeling lost. And I say feeling loss is because there's a grieving process to the dementia journey, as we all understand it to be. And so when you don't have culturally safe care, there's an additional sense of loss because you're losing the person or yourself if you're the one experiencing dementia, and there's no culturally safe care. There's a piece of you that's also being lost. Like there's a loss of the piece of you. The feeling lost is in the dementia care complex. It's already, difficult to navigate as we all understand it to be. Not having those culturally safe, inroads and infrastructure can be an additional feeling of I'm lost in this complex. I don't know what to do. I don't really know what I should be asking for. Can I ask for this? Is it appropriate? I don't know. And that can bring on a sense of additional frustration, anger, sadness, hopelessness, and it can lead to further social isolation. If you don't feel like your care provider really sees you, you can feel much more isolated in this journey at the time when you need to be around people and need to feel safe with people the most. Also, we're thinking about power when it comes to money. It's often funny when we think about money, we think in Canada, every province we have our healthcare services covered for, which we do a lot of the times. But when it comes to dementia care services, some of them are not covered. When you think about, for example, day programs, when you think about paying for day programs, access to day programs, from a cultural perspective, if you don't have the money to do so, and a lot of ethnocultural groups are so on the lower end of socioeconomic stability and security, how then do you afford to go to a day program to get the respite, to get the socialization, to get those services as well? So understanding sort of in my mind, the intersection of how culture, ethnicity, race all play into the dementia journey and where that is not recognized by the healthcare system or social care system, again, these gaps are created.
Yeah. Well, before we go to Chenny, I just have a question for you because thinking with my researcher scientist hat on, one of the things we talk a lot about is how do we make sure that the programs that are being developed that we're, when we're doing either whether foundational research or applied research, that we're including the broadest possible group of people. So it really is designed not just for, upper middle class white Western European folks who have access, but for everybody. How do we overcome that kind of barrier? And like, I'm thinking, for example, there's a lot of work being done on prevention and early detection. But given these cultural challenges, and how do we make sure that we're engaging the right people in designing the studies in a way that's going to be inclusive so that it can be as effective as possible in addressing the issues?
Yeah, that's a great question. And a lot of people really try to find the best way to do it. I would always say, whenever we want to increase research participation from different groups, the first thing you have to do is build trust. You have to get to know these groups and build a trusting relationship that would hopefully extend beyond the desire to research. A lot of times researchers, they go in and do helicopter research where they go in and take what they want from the community. Thank you very much. And then they fly out and then nothing really ever goes back to the community, not in the way of language, not in the way of learnings, not in the way of skill building. And certainly that relationship to get that information, then sort of it goes away, it dissipates. And so a lot of communities can come away feeling, for lack of a better word, used, right? So there's an apprehension to want to engage that process again. And so one thing to do is looking at communities as an end in themselves and not as a means to an end. I often say research done by community, for community, from community is the best way to do it. So increasing representation of the research teams, right? The research teams that are all a monolith can go into a different community and say, hey, we want to do research here. Of course, there's going to be a sense of distrust, right? I always think to myself, if there was a community of all women and there was going to be research on reproductive issues and, there's a team of all men doing the research, some women may feel like, well, there's a gap in experience there. So I say, build those trusting relationships, reaching out to different community groups and try to build the research with the community. We often go to community and say, hey, we want to do this. We want to research this. Let's do it. And the community will say, well, wait a minute, that's not what's actually happening in our community. We need to go about it differently. So a community-centered approach is probably the best way to do it, but a true community-centered approach, not one that uses community for what researchers would want to get from them. I think that would be the best way to do it.
We talk a lot in the innovation world about doing the design and the innovation design in the exact same way, about doing it by and with, not to and for. Right. So I think your message is the same thing on the research side. So thank you for allowing us to take this little digression.
But Chenny, I want to come back to you a little bit about what does the absence of that culturally safe care look like? Because Gotcare is in so many different communities. You're in remote and rural communities. When it isn't there, what have you seen?
Well, let's just take I want to take a quick step back to what Ngozi was saying earlier about just the stress and anxiety related to living with dementia. And I mean, navigating our healthcare system as an older adult without dementia is already hard. It's already extremely stressful. So you add this extra layer on top. And what can end up happening is a even deeper sense of social isolation. And I think that we talk about social isolation a lot, broadly speaking, but we don't actually spend a lot of time talking about, like, what is the so what? Like, what does that mean, right? So one of the things that we've seen is, especially for people living with dementia, they can feel this profound sense of detachment from their personal agency and because this lack of meaningful human-to-human connection that might be missing or greatly reduced in their life can hinder their sense of motivation or even just their own ability to seek help. And it's not just help when it comes to medical care or healthcare, just help broadly speaking. And so we've seen time and time again that if you don't have these meaningful support systems, then many people can find themselves extremely overwhelmed very quickly. And that makes it challenging to navigate even use resources that are designed to help them. There could be culturally specific community resources available if they happen to live in an urban area where that's even an option. That's even available, but they themselves cannot navigate and utilize that resource itself. And so then you zoom out to a rural context and it's just, all of the same, but worse. And so for example, one of the things that we've learned at Gotcare is that it's really, really important for us to be able to ensure that when we are pairing a person living with dementia with a care worker, that person is consistent. Like that the same person coming is so critical and so important because it builds on their ability to have a human-to-human connection with someone, like a true connection with someone. Right now, when often you see a doctor, you see a nurse, you see a PSW, it can be a different person every time. And so when you aren't able to build that connection, it really actually can further isolate you as well.
And I'm thinking back to our theme of trust. So the more that you see the same person, you're more likely to build that trust. But then also, Ngozi, speaking to your point about you see the same person, you build the trust, you're more likely to have a conversation about your needs from a cultural lens. You might be more willing to, ask or request certain things or have a conversation with the family in order to have those conversations. So I see it all coming together really beautifully in that it's this beautiful cycle of hopefully building upon strength, hopefully to improve care.
Yeah, relationships are key and the relationships are building that trust, right?
Ngozi, I know that we've talked a little bit about research already, but you have your own research program at York as part of your PhD. And as I said in your introduction, you have lived experience as a caregiver for your father. So, I mean, what has surprised you the most, whether it be from your lived experience as a researcher or a caregiver?
It's not a surprise from a research perspective. From a personal perspective, it was probably more disheartening than anything else, was that the real lack, like there's a real lack of culturally specific dementia supports for people from different backgrounds. It's sort of this understanding, this assumption that once you get diagnosed, you're just automatically going to go into the dementia complex. You have an understanding of what dementia is. You know how to navigate a healthcare system with regards to dementia, and that is just not the case. So in our own journey, there was no real supports for Black African Caribbean clients. We're African, so there's no supports for African clients in terms of like how we would understand dementia, how we would understand seniors' health. We have such a stigma in our community around mental health, seniors' health, brain health. You just don't talk about it. So there was nothing that spoke to that. So we had to navigate that, and we encountered a lot of stigma and isolation from my own family. But there was no way for the system, if you will, to help us navigate, to have those conversations. What do we say to our family? What do we say to our loved ones? So that was really hard. I also found interesting that there wasn't a lot of proactive help when it comes to dementia. Dementia is not necessarily, it's not normal for aging, but there was no proactive kind of services in how to, keep your brain healthy, how to slow down the progression of dementia, what things you can take to help. We've seen from COVID why this is important. With COVID, we saw a lot of older adults from racialized communities and lower socioeconomic communities, LGBTQ communities, Indigenous communities, really suffering through COVID because of the social determinants of health, right? And so we know the correlation between social determinants of health, life course, and dementia risk, but there's no proactive kind of supports, information out there for people, and then just the lack of culturally safe and culturally appropriate services too. So it was just sort of like I knew this, but as a consumer of it on a personal level, it just was much more jarring, and just a lot, much more disheartening, I would say.
And just coming back to this topic of culturally safe dementia care, I wonder, what are your thoughts about what the tangible impacts of, if we could get to culturally safe dementia care, what would the impacts of that be on people living with dementia and their families?
I think when you have those culturally safe services, I think you have increased trust and increased social cohesion, increased integration, and a want. People want to interact with the healthcare system. They want to call the social worker. They want to be able to be seen. They want to be able to feel valued for their personhood. And when that is there, people have a better relationship, better health outcomes. You have less of a healthcare burden, that is for sure, because people are going to be less reliant on emergency services if they feel that they can get the adequate services at home, especially from that cultural perspective. I think about, again, from a caregiving perspective, having culturally appropriate caregiving services, for example, support groups. If you can get culturally appropriate support groups for people, supporting people living with dementia, those care partners may not feel so burnt out. Those care partners may not feel like I have to go to the doctors now because I'm feeling, pressure, I'm feeling high blood pressure, heart palpitations, because they're able to talk to people that look like them, that sound like them, that have the same cultural background as them, that can help them understand what they're going through and alleviate some of their stress. Better financial security is also very significant, because culturally safe dementia care programs can look at how different communities are experiencing their socioeconomic status, maybe provide more equitable distribution. I know the Alzheimer Society, they offer some subsidized funding for some members who qualify and help them. So there might be a way of looking at those equitable from an equitable lens, the application process of the program itself, to say, hey, well, which one of our groups in society needs a little bit more of a helping hand to be able to access some financial services to alleviate their dementia burden. So I think all around you have better health outcomes. I'm remiss to say a better dementia journey experience, but the journey can be the problems of the journey can be lessened, I would say, with more culturally safe programming and care.
Yeah. And it's interesting because Rosanne and I are actually part of another podcast called Defy Dementia, which is focused on dementia prevention and raising awareness and reducing stigma. And I'm thinking, Rosanne, I'm thinking back to a number of our episodes, including the one on nutrition that came out recently, where we actually focused specifically on a woman of Indian heritage who talked about how she integrated healthy brain food into her particular form of cultural cooking, but it would be quite different in different cultures who eat in different ways. So we've been thinking a lot about these issues of how do you tailor the specific elements that are required for prevention to different cultures. And Chenny, I'm wondering from your perspective in Gotcare, are there any specific advantages that you've seen with culturally safe dementia care on people living with dementia and their families?
Yeah, I mean, it for me, it increases access, right? Like it's just access to services. You have people who would otherwise perhaps reject a service who are now open to it again, to being helped. And I think of this one family I have in mind. They're of a Southeast Asian background, and when they had a care worker who had a similar background be able to support their mother, one of the things that the family members said was, "Wow, I've never seen mom this happy in a really long time." And that is the quality of what we're looking for, right? We're looking for people who feel connected to themselves again, who feel the strong sense of identity, who feel like they have strong relationships now with people, not just their immediate family caregivers, but other people within the community as well. And it's really about fostering that as much as possible. And to go one further, I think that in the best case scenarios, then you have people who would be willing to provide and receive peer-to-peer support, because then it's no longer just about healthcare professionals, but it's about people from the community helping others in their own community, and that's where the magic really starts. There's been a couple instances in the past year at Gotcare where we've set up WhatsApp groups where we go totally hands off and we just set WhatsApp groups up. Of course, we get people to sign their disclaimers and things like that. But then after that, we just get them into WhatsApp groups so that they can be in relationship with each other without us. And there's a lot of beauty to be said in that.
So we always want our audience to walk away with some actionable strategies or tips, whether they're a family, whether they're a person living with dementia, whether they're a healthcare provider or policymakers, Ngozi, as you mentioned before. So I'm going to ask each of you, if people wanted to walk away with some tangible tips on what they should do to try to implement culturally safe care, whether as a person, as a family member, or as an organization, what would you recommend? And are there any resources you would want them to check out? So, Ngozi, why don't we start with you?
Yeah, I think whenever policymakers and decision makers are thinking about how to develop culturally safe care, there's a couple of ways to go about it. I always say, number one, do the internal work first. So within your own self, within your own institution, what is your competency and capacity to doing this kind of work? Oftentimes, a lot of people they really have good intentions of doing it. But one thing to understand is we know dementia is a long goodbye for a reason. So you want culturally safe care that can be sustainable and that can be integrated into other care models that you have, as opposed to just this one-off thing. We'll do it for a couple of years and that's the end of it. How do you build out these programs that become part of the institutional service delivery and policy making and service models? And so checking your institution. Well, what do we know about culturally based care, culturally safe care? What do we know about it? How do we increase our knowledge? What is our capacity to do so? I would say, if it's a one-on-one sort of in a care setting, recognize that the family member or the care partner is an ally in the circle of care. They have a significant role there. So asking them questions, getting to know the person living with dementia and their care partner as a full person, not just as presenting as this is the disease or the stage of the disease that they're at, or I'm looking at their symptoms and whatnot. Look at them as a whole person. Try to get as much information and background as you can. where possible, connecting with different community-based organizations within the catchment area that you work and serve in. Because a lot of the times, these community-based organizations, they may have knowledge of it, especially faith-based organizations, the churches, the mosques, the temples, the synagogues. They deal with a lot of these clients in this population, and the leaders of those institutions, they know, they talk to them, they counsel the family when they're having a hard time. So connecting with the different faith-based and culturally based community organizations can really help fill up those knowledge gaps. And you can create this partnership and this relationship with these institutions that provide a kind of a safety net that can provide more support to the person living with dementia. So say, for example, someone says, I'm not going to go to the healthcare system. I don't trust them. I'm going to go speak to my, pastor or what have you. Then, the pastor would have information of dementia. They can speak with the person and their family, give them that more support. In a formal way, the Alzheimer Society of Canada does have some great resources. So does the Alzheimer Society of Ontario, of BC, British Columbia, Saskatchewan. For different populations, they have great resources. EGAL has some great resources as well. iCare, led by Jennifer Walker and Dr. Kirsten Jacqueline, also has some great resources when it comes to Indigenous populations. These resources are out there. They're not consolidated in one area. I may have to do a little bit more Googling, but they certainly are available to folks. Canada is still gathering data, much needed data, on these populations when it comes to dementia. So hopefully we can begin to utilize more of our own homegrown data. The iCare is Canadian-based. And so the other ones that I listed, they're all Canadian-based, but we're still, there's a long way to go, but we still have some things out there for support for people.
Thank you so much, Ngozi. That's amazing. We will absolutely put all the links for all the resources that you've mentioned into the show notes so they can check the website. Chenny, over to you. What are your tips and your resources that you would want our audience to check out?
If you are a person living with dementia or family caregiver supporting someone with dementia, I think it's just really important to ask for what you need. And I know that is challenging for different people for different reasons, but really just getting really bold with asking what you need right away as one of the first things that you say in every conversation. If you're a health organization or health provider that is not connecting families to community services or community programming, I think it'd be really important for you to find someone, build a friendship with someone whose job is that. Because I can say that at Gotcare, for us, even just keeping up to date with what programs are available in what regions for whom it's a lot, right? So don't try to take that on yourself, right? Instead, try to find the people who are already playing that role in the neighborhood in which you work at and involve them in your practice in some way. And lastly, I would say just if you are looking for home health supports, Gotcare, we work with a certain number of programs across the country. We do operate everywhere except for Quebec and the Northern Territories. So if our team can help,
So far.
So if our team can help, we will definitely will. And oftentimes, people call our phone lines just to get a little navigational support. And yeah, if we can help, we definitely will.
And the website that people can go to find out more information?
Our website is gotcare.ca, and our phone number is 1-888-819-1244.
Thank you so much, Chenny and Ngozi, for spending time with us. You're both doing such incredible work, and I really appreciate it. I know Rosanne does too. We appreciate you sharing your knowledge and your insights. It was a terrific conversation, and I'm just sorry it has to end.
Thank you both.
Oh, thank you so much, Allison and Rosanne. It was wonderful to speak with you both. I truly enjoyed my time here. And thank you again for inviting me to be on this podcast. And I look forward to more opportunities to talk with you both. Thank you.
And I also want to just give a special shout out to you, Chenny, as one of our Mentorship Capital and Continuation Program recipients in CABHI. For people who don't know, any innovators listening, CABHI has this program, which we refer to as MC Squared. It's the Mentorship Capital and Continuation Program. And we provide up to $500,000 in funding for people to grow their business. And Gotcare, led by Chenny, is one of those companies. So congratulations to you on that. And it's great to have you in the CABHI family.
Thanks. Yeah, no, it's a great program. If you are an entrepreneur listening to this, I would highly encourage you to. CABHI is very plugged into not just the resources for entrepreneurs in this province, but also federally as well. So definitely would encourage it, would highly recommend that.
Excellent. And if you want to learn more about it, you can visit cabhi.com, that's cabhi.com/MC2. And thank you also to all of our listeners. And we want to thank also our podcast production team, including Monique Chang, Lisa Hartford, Taomi Lam, and our friends over at Podtax.
To learn more about CABHI, please visit us at cabhi.com. That's cabhi.com. We'd also love your support of our podcast, so be sure to follow us and leave a review on SoundCloud, Spotify, Apple Podcasts, or wherever you get your pods.